so today we're here with Dr. Enrique Cedillo, and he's one of the best plastic surgeons in Mexico for facelift. So he's going to tell us how facelift works and who can get it done. What is the difference between facelift and fillers? And please, Dr. Enrique, thank you so much for having me.
Okay, Andrea, thank you for the invitation, and I'm really glad to be here and talk about this because I'm a board certified plastic surgeon. My main issue is the aesthetic surgery, but the face of the patient is one of my patients. Okay? I do great rhinoplasti, but today we want to talk about facelift. The facelift is one of my patients. My thesis in plastic surgeon, my grade in plastic surgeon was in facelift. I compared those two different techniques, and this technique now I'm doing something new. The facelift. The facelift is a surgery that is done. The only thing that we're looking for is to make a better version of yourself. That you look younger and you look beautiful. Something that you talked before was the difference between fillers. Okay, this is something really important. This is something that we talk in the aesthetics meeting. So the difference is when I take a filler and put it in someone's face, I add some volume in the face, but this is not a rejuvenation. Okay, we are not taking back in time, only making the face bigger and with more volume, less wrinkle. But this not a facial rejuvenation. What is the difference between the facelift is the filler we can do with hyaluronic acid. It takes me like 10-15 minutes, and the facelift is a main surgery. It takes like 4 to 5 hours to perform, and the results are completely different. Okay, and don't get me wrong, some patients I do fillers and I'm really good in fillers, but it must to be a select patient. Not all the patients are good to fillers, and all the patients are good to a facelift or necklift. Okay, that is something what we study so much, because we must do a good diagnosis and see what's the procedure that is going to be best for the patient. Okay.
Yeah, and so again, when people come to you and they want to get surgery done, but you don't consider them for surgery, you would recommend fillers. But if somebody do want to look younger and fillers are not going to be the answer, you would recommend surgery because you have experience. Doctor, you've been a study for over 17 years, and he focuses on the facelift, so he knows this. And if he tells you that you do need it, it is because he can tell you the diagnosis. And also when people come to you or maybe text you over Facebook or Instagram, it's like, hey, how much is a facelift or a neck lift? It's different, right? Every patient is different.
Every patient is different, and the way that we age is different in every patient. Some people have more problem in the forehead, other people have more problem in the eyes, and other people have more problem in the face and the neck. Okay, and this is really important because the face surgeon must to know what is the procedure that is going to be the best, with the best beneficial and the best result for each patient. Not all the patients are treated equally, and this is really important because a lot of people, it's easy to them to add some filler, but if you don't need it, the result you don't want to like it. And then I have the other problem, people with overfill in the face that now they want to change, and this really difficult for me because each time that you have a filler in your face, you have a change. The hyaluronic acid can be absorbed by the body, but it's not completely absorbed, and also it can create something that's called fibrosis. And then when they can come to me to a really beautiful change, it's really hard to perform, and also it's more expensive. So you must to choose wisely with what doctor you go, because today we have a lot of people that assume that they can do rejuvenation by doing only fillers. So I have this problem, and I can see that here in my city, I see this in my community. I see that in movies and TV. People, beautiful people with overfill in the face. So the difference in the facelift is that we want to make your face to look like they look before, okay? Because maybe you don't know this, but the people or someone that is old and your face and my face is the same, but what it changed is the distribution of the fat parts in the face, in the superficial plane and the deep plane, and also the ligaments that support this. So when I see someone that is aged, I know what is doing here, what is happening, okay? Also, we have some change in the bone. This cannot be changed, but when I reposition the deep layers of the face, we can achieve to see the face like it looks before, okay? And this is the main difference between what I was doing before and what's doing right now. The technique that I'm doing right now is really similar to what they're doing in New York City and in Beverly Hills, because it's the deep plane facelift with vertical restore that have a main issue to restore the middle face and the neck, okay? I also, in some patients, I can do something else like upper lip lift and also blepharoplasty in the upper or lower eyelid.
So it's a combination of everything. So when you see a patient, comes to see you, you will, obviously you have all the experience to let them know you do need maybe your forehead and your eyes and your chins. I mean, but it's a combination. You cannot just diagnose one for all. And there's something really important that you said about you're doing right now here in Mexico, Monterrey. The same techniques from New York and from Beverly Hills, which are amazing but are so pricey. And that's why you want to come here to Mexico, which, I mean, it is still investment, but it is safer because obviously you do have your credentials. You're a board certified plastic surgeon with an emphasis in facelift, and obviously here in Mexico it might be a little bit more accessible for patients.
Maybe for the people here in Mexico that come into my office to have this procedure, is going to feel the same feeling of expensive that someone that is from the United States. But when they make the change of the device, the dollar versus the peso, you can feel that it's cheaper, but it's expensive surgery, okay?
Yeah.
It's not cheap because the results are amazing, are great. Cheaper is not always better, okay? You must find everything is going to be really good. One of the main issues in this kind of surgery is the safety of the patient. So what are the things I do to the safety of the patient? One of the main thing is that I do this with local anesthesia and sedation. This is safety. Why? Because the patient is semi-awake. I can talk with them. So when I'm working, I can see the facial expression of the patient. So I know that I'm in a safe plane. Okay?
So you are getting the surgery and the patient is awake and he or she can talk to you? It's not awake, but
not really awake, but I can talk how you feel.
Oh,
fine.
Wow.
Okay? And I can see how the facial muscles are moving, okay?
Oh, that's really important.
And really important. Only do this surgery, all my surgery in a special hospital that are certified by the Joint Commission International. That means the level of the hospital is similar to a hospital in the United States. And this is really, really important because if you come here to Mexico to have this kind of surgery, you must to be in the safest place with the safest doctor and the safest environment, okay?
Yeah.
Everything is going to run around the safety, and then comes the result. The result also is going to be beautiful and also is going to be great, but with everything around about the safety, okay?
And you take all these things into consideration. So you explain about, you know, the muscles that need to be awake and all the things that obviously you understand as a doctor, and all the things that are taken into consideration is for the patient to have a great result and to be safe. So I want to emphasize on that because I have people asking me who to trust, who not to trust, how to, and so it is really important for the doctor to also to have that connection with the patient and to be like, hey, you're gonna be, obviously you're in good hands because you see my results and you see my before and after, but also this is where you're gonna get surgery. This is where you're going to get the best result, and we're gonna take care of you before and after surgery. So what is the, I guess the recovery time for surgery? What would that be?
The recovery time is really fast. I only leave a drain like 1 day. I take it really fast. Then you must rest, okay? The main issue that you can do this is your face must be really steady, and if someone talks to you must to look around because the neck have a lot of work, so you don't want to lose that. But it's only like a week. After that, you're really good. The stitches come out in 7 to 10 days, and then it's like 2 to 3 weeks to look like never before. Okay,
Yeah.
maybe you want to see.
Yes, he showed me this photo of a patient that she had her surgery done, and she took a photo, and she does not have any bruises. She looks, I would say, 7 years younger, and she permitted us to use her photo.
But this is a beautiful patient that allowed me to show his photo. So what is the reason I show this? This is a patient that maybe it looks a little like tired or someone angry, but this is a beautiful lady with a beautiful feelings and beautiful inside. But maybe its outside is not looking that good. And you can see this 3 months later.
Yeah, wow.
Okay, it is 3 months later when I take this photo, because she came again to my office, but now to other procedure, you want the rhinoplasty now. Okay, if I can put these two pictures together, you can saw how his face looks completely different, but looks like she looks before. Okay, and also if you look in this photo, you can see how it's completely different, but it looks great. And the main thing that you must look is all the aesthetic lines of his face, of her face, sorry, are in line. Well, the jawlines are beautiful. That is very important to have a beautiful face. The neck is beautiful and really aesthetic, with all the aesthetic line that you can saw easily, like the central trachea and the sternocleidomastoideo muscle in line. You also can see that all the volume of the face is put in place, but it looks thinner and younger, and that's the main difference between the fillers. Okay, and also
so natural. I mean,
natural.
so natural. Like, you can even see that she even had a surgery. She just looked like she always looked younger, and this is so in place that you can see her jawline. Where a lot of people want to go in and get it done with a filler, well, you can't, because there's already so much loose skin that the doctor has to pull back, right?
In this picture, you can see the incision.
It's teeny tiny.
You can see it. Even if you are closer to her, you can see the incision, because it's really good. And also the blepharoplasty, you can see the lines. And also I do a lip lift in here. So what's the reason that you can show this beautiful result? Because it's a combination of procedure that only main issue is that you have the best result. Okay? So, well, Andrea, thank you so much for this interview. I'm really passionate about facelift. If you really want to see one, three, whatever you want, you can be my guest. If someone of you looking at this video want to know something else about facelift, you can contact me through Andrea or whatever you want. The main thing that you must to know that the facelift is a surgery that the main purpose is to only you look beautiful, that you look outside like you feel in your inside. That is my goal. Okay.
Yeah. Thank you so much, doctor, for having this interview with me. And again, I just want to emphasize that it's your face. I mean, you do not want to put that on race, and you want to bet on that with some other doctor. That I'm not saying that they're not good, but they're not as specialized as Dr. Enrique Cedillo. And if you want to get a contact with him, I'm going to have all his information in this video. And again, I'm doing this just to show you guys, just to go with the doctor that is trustworthy, that you're gonna be safe, that you're gonna love the results, and just come to Mexico and we're gonna take care of you. Thank you so much.
Thank you.